Hello everyone, this is Dr. Yaşar Pasha. I am consultant andrologist based in Istanbul. Today I would like to talk about the prevention of infection after penile implant surgery and if it occurs, how we manage the infection after penile implant surgery. Penile implant surgery is a highly effective and life-changing treatment for severe erectile dysfunction. However, like any other surgical procedure, infection is one of the most important complications we aim to prevent and manage correctly when it occurs. In this video, I want to explain how we minimize infection risk, what patients should pay attention to, and how we manage implant infections step by step if they occur. First of all, how we prevent the infection from the very beginning of the surgical procedure and process. The most important step in penile implant surgery is preventing infection before it ever starts. First of all, the hospital environment matters. We perform these surgeries only in highly modern, fully equipped hospitals with strict infection control protocols. Operating room airflow, sterilization standards, and surgical team experience all play a critical role. Secondly, the implant itself matters. We only use high quality original penile implants that are antibiotic coated. These coatings significantly reduce bacterial adhesion and lower the infection rates. Thirdly, surgical discipline is very essential. From the moment we enter the operating room until the skin is closed, every step is performed with extreme attention to the sterility, from surgical draping, glove change, irrigation protocols to minimizing the implant exposure time. Finally, surgical technique matters. In our clinic, we primarily use the intrapubic approach, which allows faster surgery, less tissue manipulation, and quicker wound healing. Faster healing means a lower risk of wound-related infections. Secondly, the patient's role, especially for the diabetic patients and the wound care. Infection prevention is not only the surgeon's responsibility, the patient also plays a critical key role. If you have diabetes, proper blood sugar control is very critical. High glucose levels significantly increase the risk of infection and delay wound healing process. Before surgery and during recovery, we closely monitor and optimize your blood sugar levels. Postoperative wound care is also equally very important. Keeping the incision clean, dry, and following all postoperative instructions precisely makes a real difference. Again, the intrapubic technique helps here as well because the incision is smaller, cleaner, and heals very faster. Wound infections and wound-related problems are less common. What if an infection happens despite all these precautions? Despite all these precautions, infections can still occur. What matters most is how we recognize and manage them early and correctly. There are many steps here. The first step is assessing the severity. The first thing we evaluate is how severe the infection is. If there is no severe abscess, no heavy drainage, and no systemic infection, our first approach is intravenous antibiotic and close monitoring. Many mild infections can be controlled at this stage without any removing of the implant. In the second step, we immediately change the implant. If the infection does not respond adequately to antibiotics and the tissue condition allows it, we may perform a same-session exchange. This means that we are removing the infected three-piece implant and performing extensive irrigation and then implanting a new three-piece prosthesis in the same operation. When feasible, this is a very good option because it avoids penile shortening and preserves the function very well. In step 3, we can do salvage procedure. What does it mean? In more complex cases, we may choose a salvage procedure. Salvage procedure involves the removal of the infected three-piece implant, replacing it with a malleable one. The goal here is to reduce the number of components of the implant and lower the bacterial load. However, it is important to be honest that this approach still carries about a 25% of risk of reinfection, and in some patients the implant may eventually need to be removed again. In the fourth step and the last step, complete removal and delayed reimplantation is on table. If the infection is severe, with extensive tissue involvement, abscess formation, or uncontrolled inflammation, the safest option is the complete implant removal. In these cases, the implant is removed and the patient receives intravenous antibiotics for a while and an oral one, and we carefully prepare for delayed reimplantation around 3 to 6 months of first surgery. In this period, preventing the fibrosis during waiting period is really important. One major concern after implant removal is corporal fibrosis. If you wait for 6 months without any intervention, the corpora cavernosa may scar and close, making future surgery more difficult and potentially causing a penile shortening. To prevent this, we place a calcium sulfate based spacers inside the corpora. This helps to preserve us to make a space and anatomy during the healing period. After approximately 6 months, once the infection is fully resolved, we perform the definitive penile implant surgery under safer and more controlled conditions. As a closing message, infection in penile implant surgery is a serious issue, but when managed properly, it is not the end of the road. With proper prevention, correct patient selection, advanced surgical techniques, and structured infection management, we can protect both patient safety and long-term functional outcomes. That's why the experience, technique, and the clear strategy truly matters in penile implant surgery. You can see here we have many Center of Excellence awards, which guarantees that we are a high volume center in European zone and we have a good background and good outcomes after penile implant surgery. Please choose your surgeon very well, very carefully, and please choose your implant very carefully, because for a perfect implant surgery you need a great surgeon and a great implant itself.